Hi, I'm Paula. I'm a respiratory therapist with Allegiance Home Medical. Some of the big things that happen is bridge of the nose, irritation, soreness, redness. For some people, they actually have sores on the bridge of their nose just because of where the mask is rubbing on the bridge of their nose. It can be very irritating. Some other issues would be the cheeks. Some people get red lines on their cheeks, and it may take several hours for them to go away once they get out of bed. So those red lines on the cheeks can be painful and, of course, annoying because people do not want to have red lines on their face when they're going to work. Forehead, some people get irritation on their forehead as well. And then leaks is the main one. Leaks in the eyes, leaks down by the chin, leaks that are uncomfortable and annoying when you're trying to sleep. A lot of people wake up because of these little leaks that annoy them, and then they have to reposition and refit the mask and readjust the Velcro, and it can be annoying, and some people then just stop either using the machine or just stop that night. Say they're 4 hours into it and they stop using it for that night and start again the next night. So if I can set someone up with some Remzzzs and it helps them out a lot, it decreases their frustration, decreases my frustration in helping them because now I've helped them. And they'll still come back to me as a patient because now they'll be compliant and they'll be coming back for supplies on a regular basis. So if I fixed the mask problem, they're happy, I'm happy. It frees up my time a little bit more to help brand new patients to get them going on the right direction. But again, I'll keep them as a patient because they're going to be coming back for more Remzzzs, for more supplies on a regular basis. Prior to Remzzzs, when I was helping someone fit a mask or refit a mask, basically all we could do is try a different mask. There wasn't a lot else out there we could help them with. So even if I tried them on a different mask, they may still have the same issues. Many of the masks are the same shape as every manufacturer, but slight differences. So I was finding many people were still having the same issues as they had before. Irritation on the nose, the redness on the cheeks, and the leaks in the eyes were the main thing that people would get very annoyed by. But once we were able to find that Remzzzs was out there, then it really eliminated a lot of those problems. It solved a lot of those problems that we couldn't solve before the Remzzzs.
The best way to tell which type of mask you have is to look at the mask itself. So you grab your mask and you look at the front of the mask, generally right here on the mask side or up here at the top or on your headgear. It will explain what your mask is. So there's on every mask there's a name of the mask here. Generally it can sometimes be on the headgear also. So you can see that every mask that we have here has got a different name on it, generally somewhere on the mask. Then if you're wondering what size you wear of mask, you will find it right on the bottom of the face cushion. This is the face cushion. You'll find it right on the bottom. This is a medium. Sometimes it talks about it on the headgear also. It'll say medium, but if your headgear is different than the mask, which sometimes they're interchangeable to other masks, you want to always look on the mask cushion itself. It will say right on the bottom, generally, medium or small or large. Most customers ask us, how do I know which size Remzzzs to put on my mask? And what we tell them is if you are wearing a medium mask, you would generally need a medium liner. But when you put that medium liner on your mask and try to put it to your face, if you don't have enough that you can grab a hold of and pull out on to get at least 3/4 of an inch past your mask, then the liner's too small. So you would have to go to the next larger liner, which would be a large liner. Even though you're wearing a medium mask, it would be important that you go to a large liner so that you have more liner to grab and to stretch, because the liners stretch. That's very important though, that it does stick out past your mask at least 3/4 of an inch or further. It doesn't matter how much further it sticks out, because that actually keeps the seal from being broken with the liner. It keeps the mask from grabbing the liner in the night if it moves and pulling it into your mask. So it's very important that you do have excess liner sticking out past your mask. Also, if it's not quite large enough, it'll want to stick into your eyes, which if it's large enough that it's fit correctly on your mask, it will lay forward towards the mask and not into your eyes. If the liner is coming into your mask at night and creating a leak, It's because the liner is too small to begin with, or you're not stretching it enough to stick out past your mask far enough. It needs to protrude past the mask at least 3/4 of an inch.
Normally I would teach the patient to wash their face and remove all the excess oils on their face before they put the mask on. But with the Remzzzs liners, we don't have to do that. We actually can use moisturizer because it helps with the fit and it helps seal it on their face a little bit better if they actually have some moisturizer or lotion on their face. So yes, they can use moisturizer with the liners.
We suggest that you use any lotion that you like, that it's good for your skin, and that way it keeps your skin more like it's a natural oil that would allow the liner not to then move across your face with your skin being completely shiny smooth. Another question we're asked is, what about the forehead liner? The forehead liner is very important with the mask because it allows the mask not to slip across your forehead, because your forehead can become oily at night, and the liner actually dries up the oil and allows the mask to stay in place better. The forehead liner is reusable. That's why there's only 2 in a box of 30 liners. We do suggest that you change the facial liner every night for hygienic reasons, but we do leave it up to personal preference. Another question we're asked many times is, can we wash the Remzzzs liners? People try to wash them, but when you wash them, it shrinks the fabric, it shrinks the fibers so they become non-absorbent again, and also then they curl, and so customers tend to want to iron them with an iron. That actually presses the fibers together so they become non-absorbent, and they don't absorb oils anymore, and they become smooth so the air passes right past them. If you're experiencing leaking in your eyes and around the bridge of your nose, I suggest you try 2 liners that will fill in some of the areas that maybe the mask is not filling in. If you're using 2 liners one night, the second night you can flip the liner over and put the clean side against your face. Sometimes customers can't put their face down into the mask because of a neck problem. We have a suggestion that you take 4 drops of a water-based gel and put it on the facial liner, and then put the liner on it, and that will stick it on there till you can get it up to your face and get it positioned. And the water-based gel will dry out and won't affect the cushion, the face cushion on your mask. If you're still experiencing a redness on the bridge of your nose, it can take 10 to 12 days to heal that with the Remzzzs, but it's very possible you need to speak to your DME or durable medical provider of the mask, because the mask might be too short and it's resting in the wrong spot on the bridge of your nose. The question is, will Remzzzs work if I have a bearded mustache? And the answer is yes, because the liner doesn't allow the air to pass through the mask as fast as it does when it goes through hair on your face. The question is, can I use Remzzzs on my face if I have a scar or a deformity on my face? And the answer is yes, because the Remzzzs fill in the irregular areas on the face or the skin. Some customers wonder why the hole in the center is so small. It's because Remzzzs are made that way for a custom fit. They're designed to stretch, and the hole in the center stretches 3 times the size of what it is, so that it'll stretch around your mouth, and then also for nose, it'll stretch around the nose as you pull out on the mask liner to adjust it to fit your mask. If you have an open sore on the bridge of your nose, first of all, check with your doctor to make sure that you don't need to do something different. But we suggest putting a Band-Aid over the sore, and don't put the Remzzzs directly on the open sore. And then it could take up to 2 weeks for that to heal. But always check with your doctor if you have an open sore on your nose, because they would better tell you how to treat that open sore. We're just suggesting that you don't put Remzzzs right on the open sore. If you're still having trouble with Remzzzs or having struggles with your mask or have questions about Remzzzs, we suggest that you email us at info@remzzzs.com or help@remzzzs.com, or call our 800 number, which is 877-473-6999. That's 877-473-6999. If you don't see your mask listed on our website, you can give us a call and we'll try to help you to figure out which liner would best fit your mask.